Bonjour à tous, j'espère que
Hello.
vous nous entendez bien. Nous sommes dans une situation particulière et nous allons avoir l'occasion pendant 1 heure d'échanger avec des invités prestigieux sur un nouveau dispositif qui a été mis en place depuis quelques mois, très pertinent, que l'on appelle ACTA, une alliance pour un accès à de multiples innovations face au Covid-19 qui nous bloque les uns les autres. Heureusement que la technologie nous permet d'être tous ensemble. Je voudrais vous accueillir, ceux qui viennent de rejoindre cette session du Paris Peace Forum, et aussi inviter nos speakers qui sont avec nous aujourd'hui à pouvoir intervenir sur cette question très importante. Nous avons tous aux quatre coins de la planète aujourd'hui malheureusement un masque sur la figure lorsque nous nous déplaçons. Et nous allons pouvoir voir ensemble la pertinence de cet outil qui réunit différentes organisations et les gouvernements. Alors, pour commencer, je voudrais vous rappeler que dans cette table ronde qui va parler de ce rempart, une alliance, ce rempart contre le Covid-19, nous avons Marisol Touraine, qui est actuellement la présidente d'United et qui a été ministre de la Santé en France. Nous avons également Adar Poonawala, qui est le CIO, le directeur du Serum Institute en Inde. Il va nous expliquer, chacun d'entre eux va nous expliquer ce que fait leur organisation. Seth Berkley, qui est le directeur, le CEO de Gavi, Global Alliance for Vaccine Initiative, ainsi que Jérémy Farrar, qui dirige une des plus grandes fondations au monde, le Wellcome Trust. Rappelons le sujet sur lequel nous allons entendre nos prestigieux invités, celui d'un travail multilatéral, multipartenaire pour faire face ensemble et partager les risques dans une optique également d'une généralisation de la capacité vaccin, traitement dans tous les systèmes de santé. C'est la vocation de cette initiative ACTA, Access to COVID Tools Accelerator, et elle est née le 24 avril à l'initiative de gouvernement. La France est engagée, elle est abritée aussi à l'OMS. De grandes fondations comme la Fondation Gates, le Wellcome Trust et d'autres ont participé à cette initiative. Et bien sûr, des dispositifs uniques tels que le Fonds mondial. Nous aurons une vidéo de Peter Sens et également de Catherine Aboem de FINE qui ne peut être avec nous. Et bien sûr, United, Gavi qui sont représentés. Donc, il y a 4 piliers, je précise ça pour nos auditeurs, nos participants qui ne sont peut-être pas familiers avec ce dispositif très innovant. Il y a 4 piliers majeurs dans ACTA. Il y a un pilier qui concerne le diagnostic. Le diagnostic a souvent été dans le passé un aspect négligé de la santé. Il est très important pour détecter et pouvoir renseigner sur le meilleur traitement. Il aide aussi pour le vaccin. Le deuxième pilier, c'est tout ce qui touche les traitements thérapeutiques. Le troisième, le vaccin, tout ce qui touche le vaccin. Et enfin, les systèmes de santé. Les invités que vous allez entendre maintenant vont chacun s'exprimer pour expliquer comment leur organisation est impliquée dans ce dispositif innovant, très ambitieux, et où ils en sont, dans un premier temps, dans ces actions-là. Ensuite, nous aurons un autre échange pour voir plus les perspectives. Donc, je vais inviter d'abord Madame Touraine à s'exprimer 3-4 minutes pour nous rappeler la vocation d'United et concrètement aujourd'hui ce que fait United dans ACTA.
Merci beaucoup Benoît pour cette présentation. C'est vrai que nous aurions préféré nous retrouver ensemble, mais c'est très important compte tenu des enjeux que de pouvoir échanger. Maintenant, I'm going to switch into English. United is the co-leader of the treatment pillar of ACTA with the Wellcome Trust. Hello, Jeremy. And we also work actively on diagnostics. I don't know if everyone knows exactly what United has been doing since it exists 15 years ago, but we have been fighting against HIV/AIDS, TB, and malaria, and we transform access to care for hundreds of millions every year. And we learned 2 basic lessons. First, governments, organizations, and civil society need to cooperate, to mix their specific expertise. And UNITED into ACTA brings its solid expertise in cooperative work. The second lesson is that we know it's impossible to protect yourself alone from a pandemic. No one is safe until everyone is. And that is our mantra. So that means the solutions we develop against COVID-19 need to be suitable, accessible, and affordable to everyone, everywhere, including the most vulnerable. So what does it mean precisely for what UNITED is doing within ACTA? First, we support and accelerate the development of game-changing solutions to fight against COVID-19. And second, we make sure that these solutions, those game-changing solutions, are suitable, affordable, and accessible to all countries and everyone at the same time, whatever the economic status is. So very concretely, what does it mean? We make sure that the tools we found are suitable to the environment of everyone. For instance, we need to have treatments which are stable even in high temperature conditions, for instance. Second, we work to secure adequate volumes of production of the vaccines, the treatments, and the diagnostics. We also see how to guarantee reasonable prices for the treatments or the vaccines. And last, we work with countries to be sure that they're going to be able to face the challenges to receive those treatments and those policies. So it's a very concrete work we are doing, and I would like to give you two very precise examples of what we have succeeded to do since last March. For instance, we secured the advance purchase of nearly 3 million doses of dexamethasone, which is a very powerful treatment which can be used to treat several severe cases of COVID-19, and those 3 million doses represent more or less half of the need in low and middle income countries. Second concrete result we have obtained, we made 120 million rapid diagnostic tests available in low and middle income countries, with, of course, our partners. So to conclude, what I want to say that we have been working hard with our partners, and we can prove that multilateral action, cooperative action is very efficient. Some people think that multilateralism means talks and talks and talks only. What we do proves that multilateralism is not only about talking, but about acting, and we have results when we work all together.
Merci pour cette intervention très claire sur la mission d'UNITED et les actions en cours avec des chiffres et en même temps cette approbation de cette démarche multilatérale, de cette alliance. Je vais maintenant passer la parole au docteur Adar Poonawala qui dirige le Serum Institute of India. Could you please let us know what you are doing right now and how you are a member of this initiative and you bring your expertise to this strong initiative?
Thank you, and a very good evening to all the participants and the distinguished panelists. So if we go back to April, May of this year, we really didn't know what kind of role we will be playing in this crisis, because as everybody knows, we do make low-cost vaccines, and we've been working with Gavi, UNICEF, and WHO for many, many years, making all kinds of vaccines for children for the last 5 decades. But it was about taking the risk early on and then partnering with academia and industry to be able to have the technology to manufacture these vaccines. And the key part here was that we wanted to back technologies that were proven. We didn't want to reinvent the wheel and go into something which would have to be stored at minus 70 degrees and have logistical issues. We didn't want to invest in technologies that weren't safely proven, in humans before. So we went in for, the adenovirus, the live attenuated virus vaccines, and now we have 5 different COVID vaccines that we're going to produce, starting with the Oxford vaccine candidate that will probably be under emergency licensure in December, January, and then Novavax, Cotogenix, and so on. So the role of Serum Institute of India and, of course, the other manufacturers from India is going to be a very crucial and vital role, as the earlier panelists mentioned, in providing the low-cost, affordable, and safe vaccines in very, very large volumes, hundreds of millions of doses, maybe billions of doses to the world in a very short period of time. And that's exactly the kind of work we need to do collaboratively. And thanks to Seth and Gavi and COVAX now, we will be able to make these vaccines accessible. And I must say that if we don't come together and bring down the vaccine prices, at least for the first 2-3 years during this pandemic, which is what Serum Institute has always done, let's say below $4 or $5, I don't know how the funding will ever come into place to take care of all these countries that have signed up for COVAX, and it's going to make Seth's life very difficult to achieve his goals. So, this is what Serum Institute has been doing. These are the challenges that lie ahead, especially with these vaccines that we don't know how long they'll protect us for. Of course, the hope is that with 2 doses, you get a long-term protection. But, Serum's expertise, just to conclude, is to manufacture these low-cost, high-volume vaccines, and that's exactly what we plan to do and hope to get ahead of this pandemic. Thank you.
Thank you, Dr. Hada. You remind us that, of course, there is a key word in this initiative, which is access, equitable and universal access to vaccines and all the treatment and diagnostics. And by the way, strengthening health system. It's a good transition to Gavi, to Dr. Seth Berkley. Seth, you are with us today. You are very familiar with the challenges in vaccines. Could you explain us what you are doing right now? And everybody is expecting, we heard recently, a few days ago, that one of the biggest pharmaceutical companies are reaching maybe 90%, but with this difficulty for the conservation of the vaccine with minus 80 degrees. So people need to understand what's going on.
So Benoit, very nice to see you again. And of course, I'm delighted to see all of my fellow panelists, all of good friends. Let me just start by explaining what Gavi is so that people understand. Gavi was established 20 years ago, now close to 21 years ago, and it was really about the power of vaccines. There were new and exciting vaccines that were coming out, and the challenge was getting those to the people who perhaps you could argue needed them the most, which is those living in the poorest countries, but they were originally high cost, low volume, and our goal was to turn them into high volume, low cost, as you just heard from Otter, where, we've been able to reduce prices by 90 to 95% by dramatically scaling up and serving the world's population. And so we've, over the last 20 years, immunized more than 822 million additional children and young adults, preventing more than 14 million deaths. But on top of that, we also work in the global health security area. We keep the stockpiles for the world for diseases such as cholera, yellow fever, meningitis, and now Ebola. And we've also done more than 1 billion doses in campaigns as well, and introduced 496 new vaccines. So on that, the alliance is really good. And what's really, I think, special about this is it is an alliance. It's not an organization. It's taking the best of what WHO, what UNICEF, what the World Bank, what the Gates Foundation, what civil society, what the vaccine industry can do, working together to try to drive this forward. And so that's kind of the philosophy. We've seen an expansion from a few diseases to many diseases, from 5 manufacturers to 17. So that's what Gavi does. Now, when we saw this new disease appear, the first thing we thought of is, gee, we need to make sure that the developing countries are not left out and that we could go ahead and purchase vaccines for those countries. But what we rapidly realized was that there is a risk that the wealthy countries could buy up all of the vaccine supply, and therefore there wouldn't be, even if we had the money, the ability to move forward. So part of the ACT Accelerator, and we lead the vaccine pillar along with the Coalition for Epidemic Preparedness and Innovation, CEPI, we began to look at how we could organize this, and we created a new effort called COVAX, and the idea here was to try to get 2 billion doses initially by the end of 2021 for the world. And that's what we thought was the volume. If we can get more, that would be great, but that's what we're looking at. And the idea was to try to have it be equitably made available. And this is important because studies have shown that if you took 2 billion doses and you gave it to the 50 highest income countries, you would reduce deaths by about 30%. If you took those 2 billion doses and distributed them equitably, you would reduce deaths by 61%. So this is really the goal that we're trying to do, but we had no idea whether there would be interest in this. We knew that the developing countries had experience working with us, but the exciting thing is multilateralism really has worked. We've had 186 economies join us. We expect more to be joining us. That's more than 90% of the world's population. We're also creating a humanitarian buffer. And the idea is to create a portfolio of 10 to 15 vaccines, the largest portfolio in the world, to maximize the probability of success, but then also to narrow that down, to work with manufacturers like Adder and other manufacturers to make sure that we can scale up to the maximum levels to protect as much of the population as is possible.
Merci pour cette explication très claire sur les enjeux qui sont considérables face à cette pandémie et notamment cette volonté très forte dans le dispositif de prendre en compte l'ensemble des pays, évidemment ceux qui sont les moins favorisés sur le plan de la santé, puisque c'est une occasion unique aussi pour les aider à se développer de ce point de vue-là. Voilà, en tant que modérateur, je vais rester sur la langue française, c'est ce que l'on m'a conseillé pour la bonne organisation, et nous avons la chance d'avoir un interprétariat pour un maximum de personnes soient connectées à cette session. Jérémy, vous avez eu une grande expérience de terrain expatrié directement dans des pays avant d'être le directeur général du Wellcome Trust. Vous connaissez bien ces réalités des systèmes de santé. Vous connaissez d'ailleurs l'ensemble des réalités aussi du vaccin, du traitement et du diagnostic. Le Wellcome Trust est une très grande fondation en santé. Pour vous, dans cette alliance qui est un nouveau modèle, quelle est votre activité aujourd'hui et quelles sont vos attentes? Est-ce que vous considérez que c'est par aussi cette capacité à travailler ensemble, gouvernement, acteurs privés, publics, cette approche transversale multilatérale, que nous allons gagner en capacité de réponse globale?
Thanks, Benoit. It's very, very good to see you and join with the others in a pleasure to be there. I feel I know Seth's backdrop and that boat behind his left shoulder better than almost any other room, given how many conferences we've been on, as well as Marisol and great partnership with Unitaid. So yeah, thanks for letting me join the Paris Peace Forum. Just to say at the start, I do hope the Paris Peace Forum continues with this interest in health. We all know there's no peace without health, and indeed there's no health without peace. And so I think they do go very naturally together, and pay tribute to the Paris Peace Forum team who have brought us together. Wellcome, as you've said, is a charitable organization. I think it's the second biggest in the world, second to our very good cousins or sisters or great partners at the Gates Foundation. We were set up by an American 85 or so years ago, and we're headquartered in London, but we are a global agency, and we're very, very proud to be part of the ACT Accelerator. Before I go on to the ACT Accelerator, though, I would just like to pay tribute here to the World Health Organization. They have acted as the hub of the accelerator. They've done an absolutely phenomenal job in that, and also pay tribute within the WHO to the emergency team led by Mike Ryan, and also the R&D blueprint, which was set up some 5 or 6 years ago now, but which has really been the bedrock of the Ebola vaccine trials many years ago, and also the Solidarity trial that's now going on around the world for therapeutics, and they deserve enormous credit. I would say at the start of the ACT Accelerator comments, because this often comes as the last comment, and I think, and I'm absolutely sure my co-panelists would agree with this, I think one of the real drivers of the ACT Accelerator is ensuring that equity and access is absolutely at the heart of it, not tagged on at the end, not added on as an afterthought, but learning from the philosophy of Unitaid and of Gavi and other agencies that are partners in it, that is the #1 priority. And from that, everything else flows. And I think the ACT Accelerator has done a great job in stressing that. Also very important to say that the ACT Accelerator is a coming together of many partners and organizations bringing their skills to bear, but putting the ACT Accelerator first. And Seth has described the vaccine work beautifully. We work very proud to work in partnership with Marisol and Unitaid on the therapeutics, but we must not forget the pillar of the health systems, ensuring we have oxygen and PPE to deliver everywhere, and indeed vaccines and therapeutics, and also critically the diagnostics. These often can get left behind, I think, and it's critical that the power of the ACT Accelerator is all 4 of those, not any one of the individual elements. And, you know, remind everybody that we have treatments and diagnostics and vaccines for all sorts of infectious diseases. And for the long term, we will need all 4 of those pillars, not just one magic bullet that may treat people or indeed may vaccinate people. And then the last thing I'd say is, I think over the last 5 or 10 years globally, I think we've looked into what I describe as the abyss of nationalism, where we've thought that there were solutions to be found within an individual country or within an individual organization. And the truth is, the great challenges of the 21st century, epidemics, drug resistance, inequality, energy, water, mental health, these are transnational. And the only approach to that is going to be working in public-private partnerships with the Serum Institute of India, with industrial partners, but critically across borders, across continents, and with equity and access at the heart of it. And I'm delighted that ACT Accelerator has pushed that to the very fore.
Merci Jérémy pour cette intervention très claire et pour rappeler le rôle clé de l'OMS dans ce dispositif accélérateur. Je dis accélérateur pour aller plus vite, pour résumer, et puisque c'est un dispositif face à quelque chose auquel nous n'avons jamais confrontés, il y a une façon de réagir ensemble avec un mode d'accélération que l'on voit, et que ce Covid-19, s'il réussit à travers vos opérations, va permettre de renforcer les systèmes de santé, donc de rendre plus fort globalement l'ensemble des populations. Juste avant, Seth l'a rappelé, on double le pourcentage si effectivement on prend bien en compte l'ensemble des systèmes de santé. Les virus n'ont pas de frontières, ils vont passer nos frontières, ils les passent déjà, ainsi que les vecteurs, les moustiques, tout ça vous connaissez par cœur. Et effectivement, on ne peut pas raisonner avec des murs quand on raisonne dans la santé, vous venez de le rappeler, et la démonstration est faite avec vous, les panélistes ici, que ce projet est en marche, il peut réussir. Alors, avant de passer sur une deuxième séquence de questions, nous allons entendre l'intervention de 2 personnes aussi très participantes, très actives, Peter Sands pour le Fonds Global, le Global Fund, et Katharina Bohem pour FIND. Donc, une vidéo est prévue puisqu'ils ne pouvaient pas être avec nous dans cette session.
The Global Fund and FIND, the Foundation for Innovative New Diagnostics, are the co-conveners of the ACT Accelerator diagnostics pillar. Working together with partners, we're striving to accelerate the development, evaluation, and launch of new diagnostic tools, and to ensure equitable access to every community and country that need them. Diagnostics are the foundation of the global response to COVID-19. Effective testing is the basis of the test, trace, isolate strategies, which are the most effective way of containing the pandemic before we have more effective treatments or a vaccine. But also, as we get more effective treatments, testing will be crucial to determining who should get what. And similarly, testing will be vital to helping us identify how well vaccines are working and again, how to prioritize their deployment. The ACT Accelerator diagnostics pillar has already demonstrated its impact. In September, partners put together an end-to-end package to accelerate the approval, launch, and deployment of the first 2 antigen rapid diagnostic tests to meet WHO's performance criteria. So funded the evaluation, WHO, the approval and guidelines, the Gates Foundation, a volume guarantee, the Global Fund put $50 million on the table for initial procurement, and a range of partners helped with technical assistance and capacity building. The ACT Accelerator diagnostics pillar is playing a crucial role in the global COVID-19 response.
As Peter has said, our ACT Accelerator diagnostic partnership has made progress. Antigen rapid tests were developed incredibly quickly compared with previous pandemics. Within 8 months, we had quality tests ready for rollout versus 5 years for HIV, for example. We urgently need funding to deliver tests to the people who need them now. To procure the tests we have today and make sure no country is left behind. The ACT Accelerator Coalition has reserved 120 million rapid COVID-19 tests for low and middle income countries. However, today we only have funding to pay for 16 million of those. We also need funding to develop and produce easier to use and more affordable rapid tests as a path back to normal life. Imagine a self-test that was as easy as brushing your teeth, that everyone around the world could access. Such a test would allow communities and economies to reopen safely, allow countries to open borders for travel and trade, allow children to return to school, allow people to return to their workplace, and to accompany a successful vaccine rollout. This is our vision. And with the right support, it could become a reality within 6 months.
Voilà donc Peter et Katharina aussi qui abondent dans le sens de notre discussion. Nous avons vu évoluer le Global Fund année après année pour intégrer la réalité des systèmes de santé dans sa stratégie il y a quelques années, plus récemment. Et nous voyons aussi le diagnostic devenir un aspect majeur de la santé, comme le porte aussi Fine dans sa mission. Vous avez tous évoqué, pour cette deuxième séquence de discussion, qui va nous prendre à peu près 10 minutes, puisque nous aurons ensuite l'intérêt d'écouter quelques questions de participants, j'aimerais que l'on revienne sur l'état d'esprit. La technique avance. On a parlé de tout ce qui avance au niveau du traitement des vaccins. United a des capacités pour ça. Nous savons aussi que chaque année, nous avons des capacités, des technologies qui n'aboutissent pas. Et je crois que l'état d'esprit majeur de ce dispositif ACTA, c'est bien l'aspect équitable, universel, puisque la santé, encore une fois, les virus, les bactéries, les microbes n'ont pas de frontières, et on n'a pas évoqué ce que vous connaissez tous par cœur, c'est les résistances antimicrobiennes, tous ces obstacles qui arrivent. Cet effort pour le Covid-19 va nous aider à gagner sur d'autres maladies, vous le savez. Mais la question qu'on se pose, c'est comment faire? Comment arriver à renforcer les capacités des systèmes de santé? C'est un travail de partenariat, de formation, et j'aimerais vous entendre sur ces aspects-là. Autrement dit, comment chacune de vos organisations et comment vous-même vous portez cet état d'esprit de l'accès universel et équitable. Marisol, si je puis me permettre de vous proposer de nous approfondir un peu ce que vous voyez et ce que vous allez pouvoir développer chez United dans ce registre-là.
Yes, thank you, Benoit. I really want to insist on the fact that the key issue, because if we have treatments, vaccines, or diagnostics, and if we are not able to provide them everywhere to everyone, we won't get the end of the pandemic. So it's something extremely important. And from that point of view, let me say that I have some kind of preoccupation before giving you a very precise example of the way we work on that. I was saying a moment ago that we work on finding innovative solutions and on equitable access. And on both sides, we have some difficulties today, I would say, to go further. We work very hard on vaccines, not United, but ACTA has been working very hard on vaccines. But I want to insist on the fact that it's not enough to work on vaccines if we're not able to provide diagnostics, treatments, and support to the development of health systems, because vaccines won't, I would say, answer to all the situation we are facing. I'm not saying we don't need vaccines, of course, we need vaccines, but we also need diagnostic and treatments. And I somehow have the feeling that ACTA is not paying so much attention to the other pillars, or not enough attention to the other pillars. The second point I want to insist on is that there is a gap, from my point of view, between the incredibly quick results, fast results we have obtained since last March, and the capacity we have demonstrated to ensure equitable access. Since last March, we have great successes on the front of vaccines, even diagnostics, a little less on treatments, even if we have some new solutions appearing. But we are not paying enough attention to this question of equitable access. And from my point of view, that's what ACTA has to do in the coming weeks and in the coming months. Develop the other pillars than vaccines and devote more attention to equitable access. We estimate that we need, for the coming weeks and months, at least $2 billion to develop diagnostic treatments and make them available to low and middle income countries. So how do we work? We work with civil society, with governments on the ground, and we never implement a technical solution without being able to provide organizational solution, training, the capacity to reach the people who need the treatment, to work with health professionals, and to work with communities, civil society. For us, it's extremely important because we won't be able to reach our targets, to reach the people who need our treatments if we don't work with civil society. So my two messages: we need additional funding for diagnostic and treatments and the support to health systems. And second, we need to work with governments and civil society to reach the appropriate people.
Merci Marisol, effectivement, de souligner cet aspect-là dans cette deuxième tour de discussion et notamment aussi d'alerter sur la nécessité d'être très attentif au système de santé, aux communautés. Il y a une grande expérience du Fonds mondial, nous le savons, sur l'approche communautaire des communautés. Et cette crise Covid nous amène aussi à raisonner sur le registre d'une démocratie sanitaire, d'une appropriation par les populations, d'une compréhension par rapport aux élites politiques et scientifiques de ces réalités. Effectivement, il va falloir plus de moyens et je crois que l'accélérateur Covid peut servir d'exemple pour d'autres dispositifs. Le docteur Hadar, tout à l'heure, nous a expliqué le rôle clé de l'accès par le prix, notamment, et la qualité des produits. Docteur Hadar, vous êtes partie prenante de cette initiative. Vous travaillez donc en tant qu'industrie à essayer de trouver de l'innovation pour que les vaccins qui vont être produits puissent arriver le plus loin possible, le plus près possible, y compris dans des situations difficiles. Voilà, comment vous prenez en compte ces réalités-là? Parce qu'effectivement, il y a des accès très faciles, et des gens qui ont des moyens, des pays faciles d'accès et d'autres beaucoup plus compliqués. Et nous l'avons vu, si tout le monde n'a pas accès, nous restons tous fragiles, puisque les microbes n'ont pas de frontières.
So thank you for the question. As I've said before, there's two things in a pandemic that are very clear. You've got to keep things simple and affordable. So whilst governments and others are trying to strengthen the health systems, better cold chain and other distribution channels are building up, you need to be able to make a vaccine that's easy to administer, easy to store, easy logistically to administer. So that would be my kind of concern and messaging to all vaccine developers and manufacturers that go in for those kind of vaccines. Once you have those vaccines, my sort of shout out would be that we need to have the vaccines at between $3 to $5, just as a rough ballpark, as I said, compared to what we're talking about, because equitable access is only possible if we bring down the prices. And it's not just about bringing down the prices, it's about also then distributing those vaccines equitably. So what we did as a policy was that we said that 50% of everything that we produce would go to our country because we have a very large population, and the rest would go to COVAX. And we would let them decide equitably to distribute these products and different vaccines so that everybody gets it in an equitable manner. And that's the kind of strategy that we've taken. And that's the kind of advice that I would like to share with other vaccine developers and manufacturers, because at a time of a pandemic, these are the key areas that we need to address. Whilst the governments and others are strengthening the health systems in terms of cold chain and so many other things to gear up to administer so many billions of doses.
Merci, Dr. Hadar. Et encore une fois, c'est une transition aussi vers cette clé pour Gavi. Si les industries arrivent à produire beaucoup plus bas, à un prix beaucoup plus bas des vaccins, et nous espérons aussi des vaccins qui puissent s'adapter à tout terrain, qui n'aient pas des conditions, comme c'est le cas pour l'instant, à moins 80 degrés, parce que forcément, c'est une avancée, une innovation respectable et qui limite beaucoup. Les industries travaillent là-dessus avec les innovations. Comment est-ce que Gavi, justement, comment est-ce que Gavi apporte aussi ses savoir-faire, ses réseaux, toute son expérience acquise depuis plusieurs années pour aider à cet accès dans les systèmes de santé. Les systèmes de santé, surtout dans les pays en voie de développement, les pays low-income countries, ont des grandes difficultés que vous connaissez. Qu'est-ce qui va pouvoir changer? Qu'est-ce que l'on peut faire aujourd'hui par les engagements peut-être des gouvernements, des ministères de la Santé, les points majeurs où on va pouvoir enfin distribuer les 2 milliards de vaccins qui étaient évoqués précédemment?
So thank you. And let me go back to what Jeremy talked about, because, we've been called coronavirus Cassandras because we've been talking about the risk. And by the way, it is evolutionarily certain that we will have other outbreaks. So today we're worried about this outbreak. In the past, we were worried about Ebola. We've been worried about flu, but we need to have better systems. So first of all, resilient health systems is absolutely critical to do this, but also our rapid and innovative funding mechanisms that can move forward, having the ability to produce tools that can be used as platforms that you can then rapidly adapt to new diseases, and then having the distribution systems. Now, the particular question you asked about was, how do we get countries ready? How do we prepare? How do we roll out? And I think what's important here is that if this had been 10 years ago, we would have said, well, we're in a very difficult time, but systems have been built up. For example, on the cold chain, we've invested, at the end of this year, we will have put 65,000 new units of cold chain in. And that's modern cold chain, using nanotechnology, using solar. Now, is that enough? We don't know, but it's certainly a good step forward. So the Gavi board has released initially $150 million to start some pre-delivery planning to go out and and take a look with each individual country. And that's what's critical, because it's going to be a bespoke plan for every country. What are their needs? Who are they going to vaccinate? How good is their supply chain? How good is their cold chain? And then based upon that, we'll move forward. The World Bank has put together $12 billion for potential financing for countries. And so others are stepping up as well. Of course, Marisol talked about the needs for the other pillars. I don't want to say that the vaccine pillar is fully financed. We have a gap of $7.8 billion to finish some of the R&D work, to look at second generations, easier to use candidates, as well as for the advanced market commitment, where we need a couple of $100 million for this year, a $2 billion target, but next year, $5 billion. In terms of the -80 question, only one of the 10 vaccines that are currently in efficacy trials has a ultra cold chain requirement. And so, but you know, it is possible if that turns out to be the only one that works. As you've seen earlier this week, we got an early look at data that suggested in very early stage that this might be a very effective vaccine. We did have the experience of rolling out at -80 for Ebola. It was expensive, it was more complicated to do, but it is doable. Obviously, as Adar said, is we have to transition as soon as we can to more stable vaccines. And the good news is that the other 9 vaccines are either stored at -20 or 2 to 8 degrees, and therefore are easier to use in those circumstances. But we need to be moving towards single-dose vaccines, and vaccines that are even stable at room temperature would be the best thing to do. Let me just finish one other point that's critical to access, and that is the terrible movement that's occurred of lack of trust in science, lack of trust in institutions. We've seen, anti-vax movements, even with existing vaccines, and this is a real challenge across the world. But given the speed at which things have moved, and given some of the conspiracy theories we're hearing, there is a real worry on how do we overcome that, and that's going to be absolutely critical. And what it means is we have to make sure that we follow the science, that there is credibility of the regulatory agencies and of governments, and not taking shortcuts around that. We need to increase speed, and that's what we've done. We have 10 vaccines in efficacy trials after 10 months. It's extraordinary, but we can't compromise on safety. And so we need to make sure the vaccines are fully tested. We understand if they're efficacious or not in all the subgroups, but then also that we reassure people that they've gone through the proper safety, and that requires civil society, it requires local communities, leaders, religious leaders, it requires an all-of-society approach, because otherwise we'll have the tragedy of having products that can make a difference, but people won't want to use them.
Oui, c'est un enjeu majeur que vous venez de rappeler, et qui rejoint ce que disait juste avant Marisol Touraine, le travail avec les communautés, les sociétés civiles, et ce que l'on appelle parfois la démocratie sanitaire, la compréhension des enjeux. Donc, je voudrais savoir aussi, pour le Wellcome Trust, qui est l'une des plus grandes organisations, la seconde plus grande organisation, comme l'a rappelé son directeur Jérémy Farrer, comment est-ce que concrètement, ces systèmes de santé, on peut les aider à se renforcer? Marisol Touraine a parlé de formation, et Seth Berkley vient de dire on peut avoir des vaccins très performants, on y arrive, mais en même temps, on a une société civile qui fait douter de toutes ces réalisations scientifiques, de cette recherche même. Et donc, Jérémy, vous parliez tout à l'heure des nationalismes, on peut dire parfois un obscurantisme scientifique aussi, des déviations. Comment est-ce que on travaille, quand on est le Wellcome Trust, sur de la recherche très performante, et comment est-ce qu'on travaille de façon anthropologique aussi sur les aspects santé animale? J'ai vu que votre nouvelle stratégie prenait en compte le climate change, global health, tous ces aspects-là. Comment avancer avec cet enjeu Covid-19 qui nous rappelle le One Health aussi, cette approche plus globale et générale que l'on doit avoir avec les communautés?
Yeah, thanks very much. And also at the heart of your question, and Seth's comment there about vaccine hesitancy, anti-vaccine movements is extraordinarily well taken, and we do need to understand that and then effectively counter it. But in the end, it comes down to trust. It comes down to trust and in confidence, and that yes, the science has moved phenomenally quickly, but we cannot compromise on safety. We cannot compromise on trust and on communication, and we know we've got a big job to do there. But at the end of the day, this pandemic is not just going to go away. This is a human endemic infection now, and the only way through this is to change the fundamentals of the infection, and you change the fundamentals of the infection through diagnostics, through treatment, and through vaccines, and then having the health systems to deliver them. And ultimately that brings you back to ACT A, because that ACT A is the way to change the fundamentals and get through this pandemic. And also, if you look at the warning signs that Seth mentioned earlier of the last 20 years, we're going to see more of these epidemics. We've seen more of them in the last 20 years. They are driven by key issues of the 21st century: animal-human health, urbanization, trade and travel, and the ability to spread around the world. We're going to see more of these. They're going to be more frequent and more complex. And so issues like the ACT Accelerator, putting science at the heart of it, and making sure that science is linked into society, is the way forward. And the progress that's been made in the last 12 months or 10 months even to produce what we've heard about today will stand us in remarkable stead for also changing other infections and non-infectious diseases, making sure we have monoclonal antibodies that can be delivered for cancer as well as for infections, that we've disrupted vaccine technology. And I think that will lead to advances in the future, which we should be very grateful of. But the greatest challenge, I think science has delivered, but the greatest challenge, and everybody's mentioned it, is there is not enough money coming into ACT Accelerator to deliver what the science of ACT Accelerator can deliver. And frankly, the world is losing trillions of dollars, euros and pounds, yen, every month at the moment. And unless we fund the ACT Accelerator properly, science can deliver what we've talked about, but we won't be able to pay for it. And this would be the greatest investment humanity has ever made to get out of this pandemic.
Tout à fait, Jérémy. Effectivement, nous avons bien conscience, il y a quelques jours, le Fonds monétaire international a sorti les derniers chiffres et l'estimation globale mondiale de la facture du Covid-19 est de l'ordre de 26 trilliards de dollars. Donc, effectivement, vous le savez tous, l'emergency preparedness, la préparation au désastre, aux catastrophes, est quelque chose qui est beaucoup moins coûteux que la réponse aux pandémies ou aux catastrophes quand elles sont là. La difficulté, c'est effectivement aujourd'hui, je crois que cette initiative sans précédent qui fonctionne, puisque vous en êtes la preuve ici, nous avons réussi Petersens, mérite, elle n'a que 10%. Je crois que 10% des besoins financiers. Donc, de nombreux pays vont arriver, des acteurs privés aussi doivent rejoindre, des fondations, cette initiative, parce que, encore une fois, vous venez de le rappeler, elle va servir d'autres maladies, d'autres enjeux, d'autres infections qui vont nous arriver par les animaux. On a oublié de rappeler, mais vous le savez tous, que 75% de nos infections viennent du monde animal, et ce monde animal, il bouge par rapport à l'environnement, l'urbanisation, comme l'a dit Jérémy. Alors, je pense que, en attendant que les questions remontent, je rappelle à nos participants qui le souhaitent que vous pouvez envoyer des questions, elles vont me parvenir. Je voudrais rappeler l'importance, je crois aussi, pour les systèmes de santé, de cet aspect formation, la transmission des connaissances, le partage des savoirs. Et comme on a évoqué le rôle clé de l'Organisation mondiale de la santé, de l'OMS dans l'accélérateur, je voudrais au passage, étant moi-même actuellement physiquement basé à Lyon, en France, à Lyon, rappeler que l'OMS a un engagement avec la France pour, à Lyon, dresser un dispositif de formation, hein, l'Académie de la santé. C'est un projet phare qui serait ici à Lyon et qui va peut-être, nous l'espérons, contribuer à irriguer les connaissances, à partager les réalités, à éviter que les opposants, je dirais, l'obscurantisme face au vaccin, tout ça ne prospère pas puisqu'il en va de notre santé à tous. Donc, après cette parenthèse sur les enjeux aussi de l'OMS, de la formation et de la place de Lyon avec des capacités ici de diagnostic chez Mérieux ou de production de vaccins avec Sanofi Pasteur, Boehringer Ingelheim, je vois la première question qui arrive et elle est sur les systèmes de santé. Alors, la question, c'est comment s'articulent les trois domaines diagnostic, traitement et vaccin avec le pilier système de santé. Donc, on voit qu'il y a toujours des questions par rapport à un système de santé. Rappelons que souvent, la perception dans les pays à faible revenu, c'est que on atteint la capitale, mais on a du mal à atteindre le reste du pays. Comment est-ce que l'un d'entre vous veut prendre la parole pour expliquer comment le système de santé, qui est un pilier, qui n'est pas un pilier technique, entre guillemets, du même ordre que le diagnostic, le vaccin ou le traitement, qui est général, comment est-ce que vous comptez le développer?
Yeah. Benoit, yes, I can provide a very concrete example because, UNITED is working on HIV/AIDS, tuberculosis, malaria since the beginning. And so the experience we have accumulated can be very useful for COVID-19 and for any other disease. I want to insist on the fact that we don't have to oppose diseases one to the other because we have to face the same kind of problems. But for instance, when we developed diagnostic tests in local hospitals, we avoid people to go to the capital. We allow them to have results of the test much faster than if they have to wait for the test to go to the capital and come back. And very often we know that the test can be lost between the local hospital and the capital. So to work on health systems is not something so abstract as what people could believe. It's very concrete. Is how can we implement local experimentations, local implementations. We have health professionals working in local hospital, people going to those local hospitals. And so we have to implement networks between local hospitals, between scientists, between health professionals. And we have done it for other diseases. It's not perfect, of course, because if it were, we would have very great health systems in low and middle income countries, which is not the case. But that's a kind of very concrete program we have to experiment to have local actions.
So
Merci Marisol de cette.
In terms of reaching out to the periphery, as you talked about, if you look at the immunization, it is the most widely distributed of all health interventions. So, if you look at a target group like infants, 90% of infants get the first dose of a routine vaccine. Of course, what that means is 10% doesn't. And that 10%, if they don't get vaccines, don't get any health interventions. And so the challenge we have is how do we extend the health system out to that last mile? And it turns out those families that aren't getting access, 2/3 of them are below the poverty level. That's where you can have outbreaks occur. That's where you have the highest maternal mortality, issues in terms of gender challenges to access. And so it's about having that strong health system, not just to do immunization, but to provide all of the services. And that's the way we have to think about it. The pillar for the ACT Accelerator on the health systems is building on the health systems work of all the organizations, which they're doing in their daily work. But what it's looking at then are cross-cutting issues like PPE, like oxygen, which are going to be important. And if I can just take 1 second to add something that Jeremy said, one of the challenges we have is with this economic crisis, central banks have stepped up And central banks, frankly, have been very good in past crises in trying to keep economies from completely collapsing. They're working to save jobs and build the economies. But the interventions for previous crises were exactly those interventions, because what they were doing was the intervention to protect the economy ultimately solve the problem. For what we're talking about, a disease outbreak, yes, it's helpful to save jobs and to intervene in the economy, but unless you have the tools that ACT A brings, and unless you have interventions that stop the pandemic, it is only a temporizer. And that's the difference. And that's why when we think about the $500 billion a month that is being spent or that is being lost in the economies, and the trillions of dollars that are being put out in packages, but if they're not spending to put the tools out, that's not going to solve the problem, and we're going to continue to have this pandemic going forward. That's the difference that we have to think about for a health pandemic versus an economic contagion.
Merci Marisol et Seth pour la réponse à cette première question qui est venue. Et effectivement, il y a un paradoxe, on l'évoquait, hein, les personnes sont plutôt à réagir, enfin les gouvernements souvent réagissent, et là on peut saluer l'initiative des gouvernements qui se sont engagés, bien sûr la France et d'autres de plus en plus, pour effectivement investir concrètement dans la santé aujourd'hui, dans cette pandémie, pour ne plus perdre autant par ailleurs, et ça c'est un point très important. Donc vous démontrez aussi cette capacité à agir ensemble. Et il y a une question qui arrive et qui est peut-être pour le docteur Jérémy Farrar, puisqu'elle porte sur la recherche autour de la santé animale. Quelle est l'origine de ces virus, de ces pandémies, puisqu'on dit d'autres peuvent arriver, et avec un aspect aussi socio-anthropologique, c'est-à-dire comment est-ce que nos réponses sont appropriées dans les pays, dans les systèmes de santé.
Yeah, I mean, the One Health agenda is just so critical, and we've been reminded of that this week with the outbreak in Denmark, and pay tribute to Denmark for their very fast actions in the mink farm. Now, the mink farm is one thing, but for me, what that showed is this virus is very promiscuous. It can go originally, as we know, somewhere near Wuhan from bats and into an intermediate host and then into humans. And we've seen in Denmark that this can go back from humans into minks and then back into humans again. This virus can go back and forth between the human and animal sector. And if it's endemic in humans, it can become endemic in animals as well. And if you look back in the last 20 years, from Nipah to Ebola, indeed, what has happened is that this human-animal interface, and then the changing anthropology, the changing way we all live. From 1976 to 2013, Ebola outbreaks were mostly in rural communities and devastating, but nevertheless could be controlled. What West Africa told us is the virus didn't change, but society had changed, and urbanization led to the devastation of West Africa 2014 to 2016. That is the world we now live in. It is the interface between human and animals, and then how humans live in these huge cities, highly connected to each other, which is why we will continue to face this threat going forward. And the last thing I'd say is, when I talk about science, I talk about the full range of science. Social sciences, behavioral science, trust, communication, biomedical sciences, and everything that goes with it. We've got to learn to do science better in a more integrated way, in a less siloed way, if we're going to really face our challenges of our time.
Merci Jérémy. Effectivement, je retiens le dernier mot, le silo, qui a souvent été évoqué. En fait, on peut comprendre que nous ayons besoin d'une verticalité d'expertise dans chacun des domaines, puisque la science fait qu'aujourd'hui, nous avons besoin de spécialistes de façon approfondie dans l'urbanisation, dans l'épidémiologie, dans la sous-nutrition, dans tout domaine. Mais la question, c'est l'horizontal, aussi le transversal, d'où cette approche notamment One Health, qui a été d'ailleurs un engagement ce matin du ministre des Affaires étrangères français, Le Drian, avec l'homologue allemand, en faveur d'un haut conseil sur cette dimension-là, d'une réalité aussi d'investir aujourd'hui dans la santé, parce que c'est gagné demain dans nos économies. Nous avons la preuve mathématique des enfants de maternelle pourraient comprendre cette addition. Donc il faut effectivement des engagements financiers plus forts dans ce domaine-là. Et je vais bientôt devoir, on me fait signe, il nous reste 2 minutes, donc je vais devoir rendre l'antenne dans 2 minutes et faire la transition pour montrer l'intérêt de ce dispositif que vous portez, que vous incarnez, vous, ici, et que c'est très important puisque le président Macron va traiter dans une table ronde dans 15 minutes de ACTA avec la présidente de l'Union européenne. L'Europe a joué un rôle clé dès le début, on l'a vu avec l'OMS, la Fondation Gates, beaucoup de fondations, et la France aussi, et notamment évoquer la question d'une charte. Cette charte ACTA qui va être évoquée dans cette table ronde avec le président Macron va notamment permettre de s'assurer que les mots-clés qui ont été prononcés tout à l'heure et tout au long de notre session d'accès universel et équitable soit une réalité avec bien sûr les moyens financiers nécessaires, les moyens publics privés. Pour cela, il faut que nos concitoyens soient convaincus que nous devons avancer ensemble de façon multilatérale et ça c'est un vrai enjeu. Alors, je crois qu'il reste quelques secondes maintenant. Après, je sais qu'on m'a prévu qu'on est coupé net, donc je voulais vous prévenir et remercier nos panélistes prestigieux ici de leur temps, de leur expertise, vous encourager à suivre ACTA, à développer ACTA. C'est indispensable, c'est une voie qui va nous aider pour les autres pandémies, pour notre santé à tous, qui est encore une fois sans frontières. Un grand merci aussi aux participants et à tout de suite pour ceux qui le peuvent dans la session suivante d'ACTA avec le président Macron et la présidente de l'Union européenne. Un grand merci, à bientôt.
Thank you very much.